For Bill, one of the really important key factors for him, having an MTHFR SNP. So that unfortunately is something we're born with. And so for him, that is one we really needed to address. Before he came to see me at the office, he was doing a plant-based diet, which is absolutely fabulous. But unfortunately for him and this MTHFR SNP, it wasn't working the best because he wasn't getting really good B vitamins that he needed for this methylation cycle. And that methylation cycle is responsible for producing our homocysteine. And homocysteine is naturally produced, but in large quantities, it can be a really kind of nasty molecule and go around and cause some abrasions and nasty things in the arteries. And that, of course, can lead to more plaquing, more atherosclerosis, which we don't want. So knowing that genetic factor, that was really key and important for him to change some of the things in the diet. So that's another thing that all patients that are on this call even today, or clinicians that want to add that into their diet, looking at genetics is really amazing and important, not only for genetic SNPs in MTHFR or some of the other detoxification pathways in the liver, but also looking at genetics and how patients will break down their medications. People that are on statins or any antihypertensive medications, it's really important to know how their genetics play into how they metabolize these medications. Because some people are poor metabolizers, others metabolize super fast. And so it just changes the way the medication will work in those patients. So I think that's really important to add in. As far as genetics too, we're going to look at lipoprotein A, and lipoprotein A is really going to tell us if we're having more of a genetic risk for developing more plaquing and atherosclerosis. So that's another really easy one that patients can look at in their blood. The other thing that we like to talk around here is haptoglobin, because haptoglobin isn't really talked about a whole lot, but we really love it because a lot of our patients do have kind of this, a lot of patients will come in and have type 2 diabetes along with their PAD or coronary artery disease. And with this having a pre-existing condition of type 2 diabetes, it's really important to look at haptoglobin gene, because with this, if we do have a change in haptoglobin in that SNP there, then some patients actually respond really well to something as simple as vitamin E supplementation. The vitamin E works as an amazing antioxidant for these patients and really helps bring down their risk of developing any more PAD or progression of their PAD or atherosclerosis, anything like that. So those are really important genetic components that, we're born with. So some things we're going to have to work around, but there are ways to work around things. With MTHFR, we have to make sure we're really on our B vitamins. We really want to make sure we are taking in magnesium to help in that cycle. So there's really amazing things that we can do once we know the information. So information really is power to our patients. So I am always asking the question, why? And I think as patients, that is a really amazing thing for you to ask from your physicians as well, is why is this happening? What is the root cause of things? And if it is a genetic component, then there's ways that we can potentially work around things. The other really important thing to look at, and we discussed with your dad's case as well, is looking at some inflammation markers. C-reactive protein is an amazing marker to look at inflammation, but it is sometimes misread by physicians in that there are two different things that we're going to look at in that one marker. We're going to look at it for systemic inflammation, but it will also be a sign of acute infection as well. So sometimes it can be misread by physicians. I've seen it time and time in my office where patients will come in and they'll go, oh, my autoimmune condition is flaring up, my CRP's through the roof. And I'm going, no, that's an actual infection. So we've got to treat that part of things. That brings things down. So that's another thing to look at for these patients, is to do a CRP. It's really an easy peasy blood test that they can add on to any of their routine labs, because again, as you discussed earlier, most people can have a normal lipid panel, and they are probably not exercising as much as Bill, because that is absolutely amazing. But they can have normal lipid panel, and it just doesn't tell us enough information. So that's another way of looking at things. I add on to all of my patients, I add on LP-PLA2, because I want to see not only are they dealing with systemic inflammation, but are they dealing with inflammation specifically in the arteries? And LP-PLA2 will give us that information. And so that really tells me, all right, if we're dealing with inflammation, is it coming from other spots, or is it specifically vascular? So that's another thing that can easily be added on to routine blood work. We mentioned earlier type 2 diabetes. Again, we want to make sure we look at that A1C, and I always look at fasting insulin, because I want to see what insulin is actually doing during that normal process.
And what about, we mentioned earlier in terms of the basic lipid panel, and that about 50% of people who suffer a heart attack have normal cholesterol in the basic lipid panel. What more should I think everybody over 50 request of their doctor to determine their actual risk if they do have normal cholesterol and maybe they have some hereditary factors involved?
Great question. So I love looking at lipid fractionation. So having a normal lipid panel is great, and your LDLs may be wonderful, which LDLs are going to be notorious bad cholesterol, right? But it's actually the particle size of these LDLs that's really important. If we have big fluffy LDLs that look like fabulous little clouds, then they are less likely to be atherogenic. If we have really small, dense particles, then those are going to be the ones we really want to worry about more. So the lipid fractionation is going to be really important to look at. It also is going to tell us, are we dealing with more problems with reabsorption? Because we are going to reabsorb lipids from the GI tract. That's another thing that normally happens. Some patients are going to have a more likely to absorb your lipids more than others. And that's going to be a genetic component to those. So with those patients, we really have to be careful of binding up and eliminating those lipids through the GI tract so that they are not reabsorbed. There's plenty of fabulous things that we can do with supplementation to really help with that and make sure that that does bind and we're able to clear them out so they're not reabsorbed. But that's another really important one to look at as far as advanced testing. You can go through Boston Heart. They are going to have amazing advanced lipid panels. But again, you can do an NMR or a lipid fractionation through Quest or LabCorp, and those are easy ones to do.
And you mentioned supplementation, and especially when you have that high cholesterol reabsorption problem, our body, yes, reabsorbs some of that cholesterol anyway, but it's the amount of it that you have to be careful of. And a high soluble fiber diet is important. And you can, for example, with my dad, add maybe some psyllium to your diet to help with that. What other supplements do you recommend usually for your patients?
Absolutely. So psyllium's wonderful to get that good fiber in there to really help bind things up. The other one that I absolutely love for my patients is plant sterols, because these will really help with the cholesterol reabsorption factor of things. So that will help bind things up and clear them out. Your B vitamins are really going to be essential. Our B vitamins, not only for that methylation cycle, but they also help in the detoxification pathways in our liver. So they're really important. And it's going to help move that homocysteine into glutathione. And glutathione is the most powerful antioxidant in our body. We really want to have more antioxidants so we can get rid of that free radical inflammatory cascade that's going on in the body. You can do other things to really help with the blood flow. Omegas are going to be great for helping thin things out. They'll also help with the antioxidant part of things. We can add in resveratrol, ECGs, GC. So those are going to be really good ones to add in. N-acetylcysteine is the precursor to glutathione. So that will be one you can add in as well. it really kind of depends on the patient and the case, because everybody is individualized in my practice. And so obviously dosage and things are going to change. Working on blood sugar, if we have problems with type 2 diabetes, that's going to be really important. But making sure that they're on things with their diet as well, because that really is the biggest component. I could give you supplements until the cows come home, but if your diet is not good, you are not going to out supplement a bad diet. Same with, you're not going to out exercise a bad diet. It's the same thing. So diet is really going to be key for all of these patients, is getting that under control.
And determine whether or not you are getting the nutrients that you do need. I mean, a lot of times you just kind of know, because you know if you're eating the burgers and fries and everything else, that you're probably not, if that's the main staple of your diet, it's probably, you're not getting the nutrients you need. But it's really important to request, to determine whether or not you're getting your nutrients, some sort of micronutrient test, blood work. But then it's also important to do that because a lot of the pharmaceuticals that doctors recommend when you do have cardiovascular disease or peripheral artery disease, they can actually deplete nutrients in your body. So these are critical tests, right? Can you be more specific in terms of the actual tests, like potassium and sodium and such, that people should request of their doctors?
Absolutely. So a micronutrient test is what you're talking about. And a micronutrient test is going to have not only our vitamin levels, but our mineral levels, proteins, amino acids, omegas. It depends on the extent of the micronutrient test as to how much of these components they're going to cover. But a good micronutrient test is going to cover all of those. I love looking at micronutrient tests because not only does it tell me where the patient needs extra help, but it also tells me if that vitamin that they got from CVS is actually working. So that's another really good test for all these patients that are like, I'm on all of these supplements and I don't feel any better. Well, maybe it's the quality of the supplements that you're taking, and a micronutrient test will give you that information. As far as medications go, statins are notorious for depleting CoQ10. So any of my patients that are on statins, one of the first things I ask them is, hey, do you have any like stinging and pain in your legs? Does it feel like you've ran a marathon when you just walked to the mailbox? Because if that's the case, most likely it's CoQ10 deficiency. So we can measure CoQ10 in the blood really easily. And that is one that a statin is going to deplete. Statins will also deplete our vitamin D to lesser of a degree, but it'll also deplete our selenium containing proteins. Selenium is really important for a thyroid. So again, we can be on a statin and that can cascade into a thyroid problem, because now we're not able to convert our thyroid hormones because we have depleted the selenium we need to work for our thyroid. So it can be this cascade effect of nutrient depletion causing other organ systems to be affected from a medication. So that's why it's really important to look at where those are so we can supplement in. And you can supplement in with not only a medication or a supplement over the counter, but you can also look and see what food sources you can add into your diet that will help support those nutrients that you're missing.
And I know for my mom, even with her blood pressure drug, that was depleting some critical minerals as well.
Absolutely. Yeah. So you're going to have, most drugs are going to have some kind of effect. So we really want to look and see, it depends on what has been documented, the actual nutrient deficiency, but they're going to have some kind of effect. And again, genetics play a component in that. So that's why a micronutrient test is really important to look at.
Thank you so much, Dr. Hines. We really appreciate you.